Magandang umaga po sa ating lahat. Good morning po. So, nandito po tayo ngayon para po sa isang session kung saan mapag-uusapan po natin yung regarding po dun sa pag-communicate ng mga paano ba natin i-communicate sa ating mga constituents, lalo-lalo na dito sa mga MHOs, mga sa LGU, regarding po yung mga information po regarding po dito sa crisis po natin na nangyayari ngayon po sa COVID-19. So, ito pong pagkakataon po nito ay brought to us by Civica po and IHO and PSPHP. So, ito po yung mga partners po natin para po ma-put into place ito pong programa po na to. So, ang mga speakers po natin ngayon, mag-talk po sila. First po si Dr. Troy Gepte. Siya po ay may experience po sa mga emerging diseases. Katulad po ang ibabahagi po niya sa atin ngayon is yung experience po niya regarding po dun sa SARS outbreak naman po. Susunod naman po natin ay si Prof. Beng Ramos Martel, and sasabihin naman po niya kung paano po natin yung communicate yung with regards to yung mga public health interventions po natin to our constituents. So, sana po itong pagkakataon po na to is learn po tayo from it, yung experiences ng isa't isa. So, first po, si Dr. Troy Gepte. Okay po ba kayo? Okay po. So, introduce po muna po natin kung ano pa po yung regarding po sa experience.
Hello? Okay lang? Narinig niyo ako?
Yes, sir.
Yes, sir.
Okay, sige. Gandang tanghali po sa ating lahat. Gusto ko sana mag-share tungkol dun sa ating experience dun sa SARS response natin noong 2003. So, noong 2003, nagkaroon tayo ng, next slide po yan. Nagkaroon tayo ng yung emergence nitong new kind of virus that belongs to the coronavirus family. Kaya tinawag ng coronavirus, meron kasi siyang corona, meron siyang crown made out of different protein molecules surrounding the virus. So itong virus ito is known to cause respiratory disease. It's very much like the common cold, ano? Pero unusual dito sa coronavirus, it can cause in a matter of days, pwede magkaroon siya ng pneumonia, viral pneumonia, and pwede mag-cause to ng acute respiratory distress, which means yung talaga mahihirapan yung tao na infected na makahinga hanggang baka tuluyan siyang mamiligro, mamatay siya. Kaiba lang dito sa coronavirus is that although it's deadly, it can be killed by exposure to ultraviolet light or sunlight. So, ang ano lang dito, medyo very unique from the other kinds of diseases. May tendency to mag-mutate, and each mutation can trigger off an epidemic of respiratory disease. Sa katotohanan, yung ating COVID-19 na disease, they have called it before, yung nCoV, which is novel coronavirus. Now they call it SARS-CoV-2. So it's from that same kind of family or that branch of that family ng coronavirus that can trigger itong epidemic of respiratory disease. Next slide, please. Thank you. I'd just like to show you a collage of pictures lang during our SARS experience during that time. At the very center, ito yung celebrated case natin. May isa tayong parang health worker or caregiver that came from Toronto, Canada, who went to the Philippines para maalagaan niya yung kanyang father. Unfortunately, she brought with her yung disease. And this is just an x-ray of her picture. X-ray picture of her parang condition when she was brought to San Lazaro na very hyalinized, medyo puti-puti na yung kanyang x-ray, which shows yung rapid progression ng kanyang pneumonia. And other pictures here are doctors and people who I've worked with in the Department of Health, including Secretary Derit dun sa corner with President GMA. That's when they first disclosed yung mga first case natin ng SARS. And dun sa upper left naman, kung nakikita nyo, si Secretary Derit worked very, very closely with the WHO, who is our partner until now with regards to how we can prepare and respond to this disease. So next slide, please. Next slide, yan. So ang konting background lang ito, it all began in 2002 nung nagkaroon ng mga first few cases in southern China, specifically sa Guangdong. And then nagkaroon ng outbreak na sa China noong November 2002. And similar to what we have now, if you notice, medyo the same time, medyo winter time, yung malamig. Nagkaroon ng reported cases outside China na February 2003. And WHO came out with a global alert no March 12, 2003. Our Philippine response sa DOH started March 17, right after na-activated yung sa WHO systems nila. And then in April 11, we had our first probable case that was reported. Next slide. It all began itong multi-country outbreak. They didn't call it a pandemic during that time. They called it a multi-country outbreak kasi we had very limited transmission of cases in different places of the world. But what happened in February 2003, there was a doctor who came from the southern part of China, went to Hong Kong for a wedding. He stayed at this hotel, sa Metropole Hotel. He was able to infect madaming guests. And these guests came back home to their own countries, to Toronto, Canada, to Singapore, to Vietnam, and they were able to infect a lot of other people. So they didn't know at that time, nung pauwi na sila, that they already were incubating yung coronavirus nito kasi nga na-infect sila ng doctor. The doctor, I think, eventually died. Itong galing sa southern China, nag-attend ng isang gathering. Next slide, please. So ito yung epidemic curve ng cases of SARS worldwide. So kung makita nyo, medyo nasa same halos ang pattern or trend ng COVID-19. Nasa bandang January, dumadami yung kaso. There were really a lot of cases ng January, February to March. And then kung nakikita nyo, towards April, March and April to the tail end of May, talagang ito yung mga curves of or peaks of cases in different countries taken together. What we had was Toronto, Singapore, and isa pang na hit talaga yung Taiwan. There were parang second and third peaks kung nakikita nyo. May resurgence siya dahil sa minsan you think that you might have controlled the outbreak na, but unfortunately mayroon pang lumalabas in other areas, other hospitals or in the community. Next slide, please. So for a little background, when WHO issued the alert, sorry, ano pala ito, 2003, I made a mistake instead of 2004. The National Epidemiology Center in March 15, 2003, sorry again, received the report of the first Filipino SARS contact who traveled to Hanoi. And on March 17, 2003, we already started our surveillance and outbreak response to determine kung sino yung mga contacts, kung sino yung mga pwede natin i-trace para malaman natin kung sino yung mga pwedeng nagkaroon ng kung sa terminology ngayon yung persons under investigation or under monitoring. If you have the symptoms, bali, you might be a suspect case, and if you have an x-ray, yun yung probable case. But if we're able to confirm it through laboratory testing, yun yung confirmed case. Next slide, please. So when we had our first probable case, there was a command conference, a press conference with the president, and she announced kung ano yung details. So at that time, noong April 2003, nagkaroon na tayo ng parang way to handle the communications, the media. So we had the press conference, we had the press release, and it details kung ano yung what we knew about the case at that time. There were a lot of new things, things that we didn't realize were parang yung information that was vital for us to be able to control yung spread ng disease. Next slide, please. So these were our operational goals for SARS. So we tried to pattern it also from other countries. We saw that it was important to minimize yung entry of these cases from outside. So we have to put up our borders, yung ating mga screening or checking at the ports of entry. Second is for us to prevent and minimize local transmission, to be able to know where the cases are, and then to find them immediately and then bring them to the health facility as soon as possible. Number three is that we were trying to prevent and minimize mortality. So the earlier that we get to see them, the better. And we try to see whether we can maybe find a certain risk factor kung sino yung nagkakaroon ng death or mortality from SARS. Number four is what we are here for, is that we need to educate the public on how to prevent yung pagkakaroon nila ng disease. So we need to also control yung public anxiety, to make people realize that we don't have to panic, but there are really things that we need to do. Number five is about yung upgrading of our facilities, our hospitals, our epidemiologic surveillance, our laboratory facilities, and our systems, which are protocols. So these are the things that yung mga the same halos dun sa kabilang slide. Disease surveillance networking were the last things. Next slide, please. Sorry, can you go back to the last slide pala? I just like to mention yung hospital preparedness. This is something I'd like to go back to probably later, pero I just like to mention that right now we are trying to do something that we weren't able to do before during the SARS outbreak. We are trying to dedicate specific hospitals to take care of COVID-19 patients. So this should be a priority for us so that we can find a way to isolate and contain yung mga diseases as soon as possible. Yeah, next slide, please. So ito na-mention ko na yung supports of entry natin. We need to work not just with the Bureau of Quarantine, but also our immigration and our airport authorities. We have a health checklist. If you remember yung yellow piece of paper. And that's what we need to do to declare if we ever have symptoms or if we had exposures. Meron tayong referral of cases to hospitals at that time. Yeah. And then for public information, we have hotlines. And wala pa kasing masyadong gumagamit ng internet doon. So we use text o yung mga text blasts. Yan. And we had the website for SARS that provided information. Very simple lang. And then nagkaroon tayo ng mga opportunities to speak, to provide information in fora. We had capacity building trainings. And we had to manage yung media dun sa mga press conferences. We had some advertisements through the help of yung mga through the DOH, of course, and the Philippine Information Agency, as well as in tulong from the private sector. And we also had some basic SARS info. Okay, for hospital preparedness, we had isolation facilities that were set up. At this time, medyo marami na compared to before, but we began setting up itong negative pressure rooms. PPEs include masks, gowns, caps, eye shields, etc. We need to also beef up yung sa lab and autopsy capabilities natin, and of course yung transport. Next slide, please. So for clinical management, we came up with our own guidelines on the clinical management of SARS. We had the triage, much like what we are doing now, nagre-revise tayo continuously as we see yung progress of the epidemic. And we have to orient our hospital personnel so hindi sila nangangapa o what they should be doing. And we had regular briefings with WHO. Next slide, please. And so for surveillance, yung mga resus, PESU, MESU natin, from the region, province, municipality to the city, sila yung tumutulong sa atin to gather intelligence on how widespread yung disease or yung dami ng mga PUIs natin na kailangan natin mga contact trace. We get referrals from different sources. We monitor contacts. We try to also use the phone or text to keep in touch with our PUIs. We had data management from our quarantine bureau, and they have a lot of parang paperwork talaga. There's a voluminous amount of work to be done with regards to collecting data, organizing it, and then analyzing it. And we need to also form our response teams to go to these places where we might have cases. Yan. So I just like to highlight na lang itong nangyari, just an example of contact tracing. As I mentioned kanina, yung caregiver or yung healthcare worker natin, she came from Toronto just before Holy Week. And she was able to go to a lot of places, 9 cities and towns in 4 provinces, and this includes yung Metro Manila. So we had 250 contacts just for one PUI na ito, o one case pa na ito. And 50 of them were close family contacts. And it caused a chain of transmission, fortunately for a few lang, from Pangasinan, Tarlac, and Metro Manila. So there were around 200 people in a wedding where the patient zero was there. No, sorry, I think these are parang pipindutin mo lang yata to get the other parts of the slide yan. Pipindut na lang lahat. Sige, please go on. So she came from Toronto, went to Japan through Narita, Japan, and then she went to the Philippines. So she went to these places. Next slide, please. So ang pinuntahan niya, iba-ibang areas. So we had a lot of epidemiologists working on this. This was unprecedented at that time. Next slide, please. So there were 2 particular periods, yung April 4 to 6 and 7 to 11, where we tried to see where she stayed, how long she stayed there, who she was with. So all in all, 250 contacts ito. So malayo ito kasi very mobile to. Baka babae natin na umuwi for the holidays. So si AC was the index case, and she was housemates with B. Yung A, yung mother niya, yung C naman yung father niya. Si A had SARS. And ang nangyari was that nakuha ni index case ni AC from A yung sakit. Unfortunately, hindi alam ni A na nahawa na pala siya when she went to a clinic in Toronto. Nung umuwi si AC, alam mo naman, Pilipino, beso-beso, so nahawa na siya doon. And she was already probably incubating when she went through Japan and dun sa airport natin. This is the quarantine of the village in Alcala, Pangasinan. It was the barangay, in specific zones or procs within the barangay, yung 1, 2, and 3. Next slide, please. So ito yung chain of transmission from A, yung index case natin. Na-infect niya yung father niya to the right, and na-infect niya a doctor and nurse and yung ibang relatives. Si A also infected someone from San Lazaro Hospital. The ones dun sa right were from RITM. So we were able to contain it kasi we were able to find everyone and then put them in close monitoring. Next slide, please. So ito yung flowchart namin dati. Medyo simple lang compared to now. Medyo marami kasi tayong tinitingnan ng mga indicators for symptoms, monitoring. Yan. Next slide, please. Doon na tayo sa SARS surveillance at NAIA. If you see, dumadami yung number na surveillance natin. Siguro mababa pa nung bandang March, April kasi nga nagkaroon na ng scare. Pero when the outbreak was resolving in other countries, dumadami na naman yung entry. So dapat talaga todo bantay pa rin tayo. Next slide, please. Ito naman yung aming ginawa. This might be funny now, kasi meron tayong internet, meron tayong messenger, Viber, etc. Pero at that time, text lang ginagamit namin, emails and hotline na telepono. Yan. So we had a total of 14 cases pala to. Hindi yan 12. We were able to add an additional 2 more from the United Kingdom. But all in all, we had 92 cases. But now we are running into the thousands of PUIs, PUMs. And ngayon, we have if I'm not mistaken, nasa 200 plus na yung ating cases. And this is a a testament to yung hard work na ginawa natin. We were the third country in the world to declare na nawala na yung yung threat of the spread of SARS in our country. The first one was Vietnam, I think, and then Mongolia, and then the Philippines was the third one yata. Next slide, please. So these are just pictures I'd like to share. Ito yung DOH frontage, yung where most of the work was on the second floor. Next slide, please. So ito yung second floor. This is where our Secretary of Health, Dr. Derit, was talking with the media. Ito naman yung aming audit team to discuss kung ano yung mga cases of SARS. Next slide, please. Yan. So this is the actual place. Ito yung place ni AC. This was the barangay where we had to talk with people, engage them, tell them what was happening and what they had to do. Next slide, please. So may mga check-up din, monitoring among our local health officials. They were doing it. Sila nagbibigay ng lectures. And I think the last slide is yan. Yung may mga PPEs din tayong binibigay. So we had to quarantine them for 2 weeks. Actually, 28 days pala. Kasi dapat 2 incubation periods ang ginagamit natin para masabi natin na wala na dun sa at the end of the second incubation period. And I think that's it. Okay, thank you.